Well, February is Heart Month, and it's just a really good time to maybe get in for a checkup and take a look at your overall health and specifically your heart health. And here to give us some great reminders and some things that we should be looking for and asking our doctors is Dr. Akunde from Premier Health. And Nina, good morning. Great to see you.
Good morning, Amy. Thanks for having me.
Thanks for being here. You know, February is one of those months where we hear a lot about heart disease and wear red, and it's just a great time to, maybe come in for a checkup if it's been a while and take a look at your health history. How do you know if you're at risk for heart disease?
That's a great question. This area has been very well studied, and it starts with your annual physical with your regular physician. There are many sets of risk factors for heart disease, many of which are modifiable, and that's the purpose of this kind of education venue. There are some things you can't do anything about, like your family history and certain types of diabetes, like the ones that young people get. But there is a lot that you can do about the modifiable ones. So risk factors like high cholesterol, high blood pressure, central obesity, which we talked about quite a bit, things like lack of exercise or immobility, I would say also people who have, the central obesity syndrome and things like that.
What do you mean by that?
This refers to the deposition of fat in your middle.
Okay.
And you may have heard about the apple versus the pear shape.
Yes, I've heard about it.
So this is the apple where they have the fat in the middle. It tends to indicate a set of risk factors that make people 2 times more prone to heart disease compared to others. So we talk a lot about things like breast cancer and other issues, but I'm here to say that heart disease is still the #1 killer of men and women in this country.
You hear about it all the time where somebody just dropped dead of a heart attack, and it's so frightening and so scary. So this is a great month to get in there, and I know we all avoid it. We don't want to know. We don't want to know, but you know what? The stuff doesn't go away, and you can actually get in there and change things, make a difference. If you know what your cholesterol level is, if you know what your weight is, you can set some goals and turn things around. So okay, let's say that you are one of those people who is at risk for heart disease. You have some of those things that we just talked about. What can you do?
Oh, there's so many things that you can do. The good thing about a lot of these risk factors is that they have common things that set them up. And by that I mean that people who have a certain lifestyle are prone to, the high blood pressure as well as the diabetes. And then if on top of that you smoke, that's a big risk factor. So some of these things by themselves are things that we take for granted, but when you put them together, then the risk becomes really, really high. So what can you do? You can eat better. A good idea would be, for example, to lower the amount of red meats that you eat in your diet, and we call that the saturated fats, the animal meats. We like to suggest that you do vegetable oils or avoid the oils altogether. Lower your overall caloric intake. Things like the foods that give you a high glycemic index, we've talked about this as well. Any extras that your body does not need, it stores as fat. And then, you have some risk factor. And then that middle deposition we talked about. Controlling your blood pressure, controlling your cholesterol. Not all of these risk factors require medications. There is a lot that you can do, and we can show you how to do that, or your doctor can decide if medications are right for you.
We're running out of time, but doctor brought basically a sheet that you can pick up if you go there to Premier Health. They'll go through it and it'll tell you if you're at risk and get you on the right path to to a better life and hopefully a much longer life. So Dr. Akunde, Premier Health, always accepting new patients, and you spend time with people there. They're not just a number, correct?
Absolutely, and that's what we pride ourselves in, is issues like this that you may not think anything of. We like to point it out to you how what you do can actually improve your own health.
Thank you so much. Appreciate it.
Thank you very much. You're welcome, Amy.
You bet. We'll be back. Stay with us.